You are welcome to my channel. Today I'll be going through the list of medications that can worsen diabetes mellitus. Diabetic mellitus and certain drugs, that is in some parts of the world, or certain medications in North America. When you have been diagnosed with diabetes mellitus, then be careful with the following medications. It is either you reduce the dosage or you increase surveillance, the frequency of monitoring your glucose, and increase your insulin, as the case might be, or oral hypoglycemic agent. You may look for another medication entirely. So that conversation should happen between you and your physician. Okay, the first on the list will be glucose tablets. If by any reason, inadvertently or cautiously, you've taken glucose tablets, expect your glucose level to shoot up. Glucose tablet could be kept in your bag if you are on insulin or hypoglycemic agent and suddenly you run into hypoglycemia. That is the only level. When you have hypoglycemia, then you can take glucose tablets. Other times, if you take it, you will run into trouble. Other medications that could shoot your glucose up will be combined oral contraceptives, bone replacement therapy, glucocorticoids, leuprolide, or goserelin. Also, if you are on some diuretics like metolazone, hydrochlorothiazide, chlorthalidone, or indapamide, your glucose level may rise. If you're on pentamidine or fluoroquinolones like moxifloxacin, ciprofloxacin, and gatifloxacin, you can have hyperglycemia. If you are on antibiotics like Dapsone, rivampin, or you are HIV positive and you are on highly active antiretroviral therapy, not all of them, your physician or pharmacist will guide you on which one that will shoot your glucose high. If you have acne and you're on treatment with isotretinoin, be careful. Your glucose level may shoot up, so you need to measure it more. If you're on diazoside, watch out. Your glucose level may rise. If you have diabetes and you are on antipsychotics like clozapine, olanzapine, quetiapine, risperidone, paliperidone, chlorpromazine, the list goes on. Watch it. Check your glucose more frequently. Watch your body for the symptoms of high glucose level before you go into hyperglycemic coma. Also bad for diabetes mellitus with sirolimus, tacrolimus, or cyclosporin. If you're on epinephrine or norepinephrine, that is adrenaline or noradrenaline, depending on where you are, tesamorelin, somatotropin, that is a recombinant human growth factor. Niacin on some statins. Statins will give you legs trouble, but it can shoot the glucose up. Niacin will definitely do. So if you're on these medications, then watch out. You might have increase in your glucose level. You will have a rise in glucose level if you are taking silent cough syrups, cold and flu medications like the decongestants, pseudoephedrine, Sudafed, or phenylephrine. Watch out, your glucose level might go up. Certain antihypertensive agents like atenolol, metoprolol, propranolol. Some of these medications may be used outside heart-related problems like thyrotoxicosis and so on. or hyperthyroidism or panic attack, or even stage fright. But then, once you're on this medication, just watch out for a rise in glucose level. That's why it's not good for diabetic people. You can use carvedilol if you must use a beta blocker, depending on what you want to gain. If it is in heart failure or a heart-related issue generally, and you must use a beta blocker, and the person is having diabetes mellitus, and you don't want to shoot the glucose up, discuss with a pharmacist or cardiologist around. Carvedilol is safer under this situation. And lastly, highly concentrated caffeine. I know some would like to find me, you are telling me to drink coffee. That's not what I'm saying. Just listen to me, please. Highly concentrated caffeine is bad for diabetic people. Why that? That will lead to increased level of insulin resistance, and it will also decrease glucose use after feeding. That is, glucose utilization postprandial will drop. But now there's room for compromise, right? Moderate level of caffeine will not give us the above trouble. So everything in moderacy, right? With that, I've come to the end of this short presentation as per certain medications to be avoided if you are diagnosed with diabetes mellitus. Discuss with your physician. He or she might increase the rate at which you screen or you test for your blood sugar level, or increase the dose of insulin or any medication you are taking, or add another medication entirely if you must still take some of these medications, or he or she will look for a different medication entirely that will bypass this trouble. Thanks for listening. Remember to share. Remember to subscribe to my channel so that you can get all my presentations immediately they are published. I appreciate it.